Omer Awan is a professor at the University of Maryland School of Medicine and a senior public health contributor for Forbes. He joins me now from Baltimore. Good to have you with us, Doctor.
My pleasure. Thanks for having me.
So President-elect Donald Trump's pick for Health and Human Services Secretary, Robert Kennedy Jr., was on Capitol Hill Monday to garner support from key senators amid strong resistance from public health groups and Nobel laureates due to his views on vaccines. But as he arrived, Kennedy said he supports the polio vaccine, saying he's all for it, despite a lawyer affiliated with Kennedy recently petitioning the US Food and Drug Administration to revoke the approval of the polio vaccine. So what do you make of these mixed messages?
Well, it's concerning and it's disheartening and it's problematic from a public health perspective when you consider what he has said about vaccines in the past. I mean, he has literally said that childhood vaccines are linked to autism, and we know that there is no scientific proof for that. And this type of rhetoric is somewhat dangerous when you consider that vaccine hesitancy is already on the rise and there's so much vaccine misinformation. And this can absolutely cause a lot of harm, particularly with marginalized communities.
And while on Capitol Hill, Kennedy also ignored other questions about school vaccine mandates. He's passed false statements linking vaccines to autism and his views on abortion. But we do know that Trump has suggested that he will give Kennedy latitude to explore the already debunked and false notion of a link between vaccines and autism. What are your main concerns when it comes to Kennedy's views on those school vaccine mandates, and how dangerous could this be?
Well, there's no harm in questioning science. I mean, science is based off of questioning. That's the whole process of scientific reasoning and the scientific method. But what is very problematic is that when you base decisions and policies against the evidence, and that's precisely what may happen. And this is what a lot of physicians and public health officials fear, that more harm will be done than good because we are going against the evidence. I mean, if you look at polio, for example, it's been proven the vaccine has saved thousands, hundreds of thousands of lives. You know, vaccines have saved millions of lives through the course of time. And to put that into question is a bit ridiculous when we consider how many kids are safe because of vaccines with respect to measles, polio, whooping cough. And this is a problem because then this casts doubt on vaccines, which have been proven to be a very important public health breakthrough in America and around the world for the last 50, 60, 70 years or so. So very problematic for science, very problematic for the safeguarding of health for Americans.
And in your latest piece in Forbes magazine, you discuss how RFK's policies on vaccinations and fluoride in public water could have devastating consequences for marginalised communities like people of colour, those in rural areas and those living under the poverty line without health insurance. You did touch on this, but what will be the likely consequences of Kennedy's vaccine and fluoride policies for these specific communities?
People will suffer. People will suffer, Rosemary, and this is the reality. You know, when you consider, what these policies may do, we're talking about these marginalized populations getting sick, maybe going to the hospital, maybe even dying because they don't have a vaccine, or they may have to pay enormous bills for dental procedures because they're getting more and more cavities. And worse, they don't have access to any of these things, so they can't even do that. So this is a problem, particularly in these marginalized populations, particularly in those that don't have health insurance, like poor individuals, particularly those who live in rural areas where they may not have access to vaccines, they may not have access to dental offices. This will absolutely have rippling effects for those populations, and I'm worried and I'm very concerned about that population. Public health is all about ensuring and safeguarding the health of all Americans, not just the elite, and this is a major problem and a major issue that we have to tackle and deal with.
And Doctor, while some Americans are appalled by Kennedy's views on vaccines and fluoride, others are thrilled about what he plans to do when it comes to the quality of food in this country, with his push for less processed foods. What do you say to that?
Well, they're separate policies. Honestly, I'm a bit concerned about his stance on vaccines, on fluoride, but I think it's healthy to go and look at food, and we should question what's in foods, particularly with the rise of obesity, the rise of diabetes, and all these chronic illnesses. So I applaud his efforts, quite frankly, at looking at foods and to see if there are any harmful products in that. But with that said, everything should be done based on evidence. And if he sticks to the evidence and he is able to look at the scientific method and to make sure and safeguard that we're doing the right things that are based on years of clinical trials, then I would applaud his efforts. And we hope for the best. You know, this is America, and we want to make sure that everyone is safe and healthy.
He seems to have changed his view on polio vaccine, so we will watch to see what happens in the days and weeks ahead. Dr. Omer Awan, thank you so much for joining us. Appreciate it.
My pleasure. Thanks so much, Rosemary.